Good morning, everybody. My name is Dr. Patrick Flynn. Welcome to this morning's quick tip. It's a beautiful Saturday morning here in Green Bay, Wisconsin, and we're going to have some fun today. We're going to have some fun today because, as you saw from the title, I'm a little bit upset today. Let me explain this a little bit because, I want to kind of cover something, and we're going to be covering some things on our show in the future. We're going to actually have an edition on there. It's going to be called Uncensored, okay? Today, we're going to start a little bit uncensored that way because we're going to cover a topic I believe that has to be covered because it's a very common medication used, okay? PPIs, proton pump inhibitors, all right? Now, the reason why we're covering it is because if you look at the over-the-counter medication, it's a very common medication used. Out of Prilosec, Nexium, and Prevacet, it's probably some of the most sold drugs over the counter. Now, prescription-wise, Humira by far dominates the world when it comes to prescription drugs. But PPIs actually cover, I think it's, don't quote me exactly, but I think it's around 3 of the top 5 selling over-the-counter drugs in the whole United States. That just goes to show you, for example, what PPIs do. So what do they do? We're going to cover that in great detail. And the part where I'm not going to be so nice about is it's kind of funny because the one thing I can't handle is extremely bad advice and then talking like you know everything in the world, okay? Because once again, it came from a patient of ours that the doctor gave him very bad advice. And so I'm going to counteract that very bad advice because if somebody doesn't stand up for what people are doing wrong, the stupidity is going to prevail. Okay. Now, a lot of people say, well, Doc, could you be the one being stupid? No. Let's walk through it and figure it out. Let's leave it up to you guys to think about it that way. The old saying is, if good people do nothing, evil will prevail in general. I'm telling you right now, this doctor's advice was downright evil of what they told him. And it's from a local doctor here, from one of the local medical establishments here. And this is the frustrating part about what we do. I try to always give out there and give great information so you can make your own choice. But today, guess what? We're going to have a little comment about the bad advice the doctor gave somebody. So I'm going to be nice, but I'm also going to be a little bit direct because really what it comes down to, and I'm going to say this, and let's start this way to be a little bit mean. Most medical doctors, I will tell you right now, the majority of them are very stupid in their thinking. Let me say it again. They're ridiculous. They can't think beyond what they were taught. And the sad part is this. Anybody with common sense will figure this out today. That's why people say, my doctor said. Yeah, your doctor is a programmed, basically, middleman. And you're wrong. I have people that I actually are good friends with that are medical doctors, and I look at them and said, you can't be that stupid. I literally say that to them. Do you understand? And once again, this is a perfect example. So if you don't like me being mean, or if you don't like me saying things like saying something, shut it off now because I'm going to offend some of you guys because you might be taking this medication. And I hear my doctor said. Most of the stuff your doctor said is wrong. Let me say it out. Most of your doctor said is wrong. And here's the sad part is this. Why am I saying this? Because guys, really think about this. What's my purpose of telling you this? People are at an all-time high for sickness. Let me say it again. Sickness. It's getting worse. There's more people on drugs. There's more people on a number of drugs than history. So if you don't like what I have to say, it's because, once again, you've been programmed since you were little. Okay? So I'm going to go through some extremely bad advice that a local medical establishment gave here. And this is common. So I can pick on Purveya very easily because their doctors give really dumb advice all the time. And so idea is this. So what I want to do is this, but it's everywhere. Okay? So here, once again, why is it very common? Because it's a very common over-the-counter sold drug. So let's start there, all right? So a person actually came in here because they had stomach problems, all right? Now, it's very common to have stomach problems because our diets are so bad today. Do doctors look at that? Absolutely not. The greatest thing that people tell about the foods, and this is very common too, they say foods have nothing to do with your health. But here, let's have every pill to counteract your food reactions that way. So we're going to start with proton pump inhibitors because the patient went in and they pulled up, actually, here we go. You can look it up, medicinenet.com, okay? No, they're wrong. This is a very common medical website. So if you want to follow along with me there, just go to, type in PPIs and medicinenet.com comes up. So actually, the patient showed this to it. I'm like going, really? This is what they put up? I'm going to show you how horrible the thinking is. Do you understand? That's the cool thing. It's their thinking that gets them in trouble. And if you challenge their thinking, they pull the card of, well, I'm a medical doctor. I don't care. You can actually have a PhD in flat earth of all I care. And that's what they do. So here we go. So let's read it. And this doctor was so, intense about his explanation of this and used this website. Let's go through a little bit. Okay. Proton pump inhibitors, side effects, lists of names and uses. Well, they're going to describe it. Here we go. Now, I actually don't disagree with what it says here. What is a proton pump inhibitor and how do they work? The mechanism of action. See, that's the key thing. See, the reason why that the Wellness Way doctors study medications so much is because we understand biochemistry, we understand physiology of the body, and medicines don't normalize it. There is no medication that normalizes physiology. And people say, here's one thing that comes up. Well, doc, that's not true because I have high blood pressure and I take my medication and my blood pressure is normal. Your blood pressure is not normal. They inhibit your blood pressure. They actually manipulate it. They change biochemistry. That's why there's a bunch of negative side effects. Because if you stop that medication, you're right back to high blood pressure as you were before. Okay? So let's look at what this does. So this doc is like intense about how great this works. But let's go on. Proton pump inhibitors reduce the production of acid by blocking. Let me say again, blocking the enzyme in the wall of the stomach that produces acid. Here we go. So therefore, when something comes into the stomach, your body actually needs to do what? Produce stomach acid. Let's go here. This whole idea that stomach acid actually causes problems in your stomach is ridiculous. Anybody that says acid is a cause of your problem has no idea how the body works. Okay, let's think about it this way. Does anybody really know the number one job of the stomach? I've been preaching this for so long, and every doctor gets this wrong. The job of the stomach, its main reason, isn't to digest food. Let me say that again. The job of the stomach is not to digest food. It's one of the things, but it's not its primary function, okay? Because one thing is this. You don't need stomach acid to break down fatty acids or sugars. Actually, you do need it for protein breakdown, but you don't need it for actually fatty acids and sugars. Enzymes, things in your mouth can do it. A lot of things absorb in your mouth that way. But protein obviously is one thing you need for stomach acid, but that's not its main job. So believe it or not, digestion is not the main job of stomach acid. Let me say it again. Digestion is not the main property of stomach acid. Number one thing it does, it sterilizes. Let me say it again. It sterilizes. Let me say it again. It sterilizes. That's its main job. And if you understand that the mechanism of action is to sterilize everything that comes in there, the rest of this doesn't make any sense. And I'll show you why infections now are one of the number one major problems with actually PPIs. Okay? And that's just the major thing. You see other things that come about that way. So it's number one job. So here we go. So it blocks. That means it stops the normal function of the stomach. Let me say it again. It stops the normal function of the stomach. Guys, right there should make you go, something is not right about this. That doesn't work this way. But see, the doctor is all excited, like, look, it inhibits, it stops the enzyme. So therefore, no stomach acid produces. Okay, listen, doc, I hope you're watching this. Here's what happens. When you do that now, you set the small intestine, the stomach, the large intestine up for major immune assault, triggering autoimmune disease, spreading infection. What major infection? Watch, let's find out. Acid is necessary for formation of most stomach acids in the esophagus, stomach, and duodenum. Okay, there we go. Here we go. Look at this. Look at how the thinking, how they put this out there. Acid is necessary for formation of most ulcers in the esophagus, stomach, and duodenum. And the reduction of acids with PPIs prevents ulcers and allows other ulcers that exist in the esophagus, stomach, to heal. I love how they actually demonize the stomach acid right away. Let's read this again. Acid is necessary for the formation of most ulcers. That's not true. You're wrong right there. That's not true. Here's what happens. Let's do this. Here, let me ask you a question. Let's take some rubbing alcohol, okay? If you take some general rubbing alcohol from the pharmacy or anywhere you get it from, that way, and pour it on your finger, what happens is your finger gets cool. It does. Actually cools, vasodilates, things like that. Do me a favor. Cut your finger, and pour alcohol on there. What do you think happens, Brandon?
It clears it all.
And it burns like a son of a gun. It burns. Do you know why? Because here's what happens. The irritation of actually having it cut open and the alcohol did not belong on that open tissue. There is that barrier there. So stomach is not necessary for the formation of ulcers. It's the inflammation, it's the damage, it's the things you do, and now the stomach is actually naturally produced whenever there's sterilization needed. And yes, it burns like a son of a gun. And yes, can it hurt? Yeah, downright, it can be painful, it can knock you down, you can bend over. But guess what? Ulcers are not necessary for the formation of ulcers. It starts way with some inflammatory process, way before acid's even there. Do you understand? Because if that was the case, guys, how many kids have ulcers? Do you understand? Digestive processes happen from the day you're born to the day you're done, okay? And guess what happens? How many kids, for example, have major ulcers? Are there some? Yes, more antibiotic use. But anyways, let's think about it this way. That's the one thing. They take normal digestion and they turn it into an evil process. But don't worry, we have your magic PPIs for you that way, okay? But it gets better. Here we go. So what diseases treat for? It goes through things that they try to alter and change that way. But here's the funny part. So let's keep on going. Here's what happens. I love all this. They're also used in combinations with antibiotics for eradicating H. pylori. Okay, I love this. So what they do is they actually take antibiotics, take protein fibers to eradicate H. pylori. Guys, H. pylori is a normal flora in your stomach. If you eradicate H. pylori, you're going to have some very bad digestive processes that way. But they treat H. pylori like it's really bad. Now you say, Doc, one of the most common infections is actually H. pylori. Yes, do you know why it is? It's because H. pylori itself is actually what? Is actually a normal flora that protects your GI. It's meant to be there. But if you don't have good sterilization, it overgrows. It's no different than Candida. Candida actually can overgrow dramatically if your immune system is compromised or if you actually have low stomach acid. All right? Low stomach acid is more of a problem than it is actually a detriment that way. See, so when they're inhibiting and creating low stomach acid, it's a bad day for your digestive tract. All right? Now here we go. The bacterium that together with acid causes ulcers. I love how they say it causes ulcers, okay? And because everybody has H. pylori. Your little baby, if you are a 1-year-old child, you have H. pylori, you have stomach acid. Why doesn't everybody constantly have ulcers? See, that's the thing that's hilarious about this, okay? They have stomach inflammation, and then all these things start to change. The key actually is you're creating so much stomach inflammation, so when we get there, we can talk about how to take care of it. Okay, H. pylori, here we go. What's the difference? Now, the most common side effects, here we go. Headaches, diarrhea, constipation, abdominal pain, farts, fever, vomiting, nausea, rash. Okay? Just some common side effects. Now, what are the majority of these problems? Those majority of those problems are immune problems. Because you're so compromising your immune system, how can a PPI actually affect and get a skin rash? Number one, because it allows your immune system to go crazy. Remember, a skin rash is just immune system with a hyperinflammatory state that way. So when actually you don't have stomach acid, immune system, for example, can be triggered by what? Unsterilized food. Anything that's in your stomach goes in your small intestine unsterilized, can actually create a huge, massive reaction that way. All right? Now, I love this one. Here we go. I love how they talk about this and they say, nevertheless, protein inhibitors generally are well tolerated. Well tolerated in what way? Do you see what I'm saying? In what way? Okay, now, here we go. This is the part I love. PPIs increase the risk of C. diff. C. diff, guys, you can die from. Do you understand what I'm saying? You can die from. C. diff is so common today. Why do I think it's so common? Because of low stomach acid. Because of low stomach acid. See, so this doctor was giving this patient advice, tell him the miracles of PPI, and so the patient said, okay, listen, how long do I have to stay on to him? He said, forever. He said, it's fantastic because, and this is what his thing was, you don't need stomach acid to be healthy. He's like, it's a major cause of problems. Guys, this is common. I'm picking on this doc at our local medical establishment, not because, once again, this is uncommon. I'm picking at it because, once again, this is advice given all over the United States, all over the world, to sell a product, for example, that is causing major detriment for this one. Now, guys, here we go. here's another major side effect that you may want to take consideration. This has been extremely well documented. It's called gynecomastia. Okay, let me rephrase it in more guy terms that way. Guys, you're going to get boobs. That's what happens. It messes up your biochemistry so much that it allows fatty deposition within your breast tissue, guys, because it's an endocrine disruptor that way. So, once again, and you see commercials like Nexium in that way, and I still love these commercials. Think about the stupidity. Eat whatever you want and take the purple peel. Just take Prilosec and calm it down. Do you understand the Prilosec and all these things fight over who can reduce the acid burning faster that way? And this is medical science at its best. It's not a joke. Reducing stomach acid can not only lead to massive, H. pylori infections, but C. diff that can kill you. Now, we're not even getting this way. Here's one thing, guys. I kind of laugh about this. If you think about it this way, stomach acid not only is actually used to actually sterilize, but let's get in some of its other uses that way. Number one, it does break down proteins. That's why I kind of giggle, for example, that if you eat meat, if you eat any kind of protein, if you have a protein shake that way, made of vegetable proteins that way, you need stomach acid to break it down. Those little proteins go into amino acids. That's why if you look, proton pump inhibitors can be associated with depression. Proton pump inhibitors can also be associated with dementia. Why? Those proteins are needed for the brain with all of your neurotransmitters. Okay? That's why you don't realize these proton pump inhibitors actually inhibit how you actually get amino acids to all parts of your body. You'll see, for example, people get stomach problems. They will actually reduce the amount of protein being put in their body, and they'll start to get muscle wasting. Okay? That's why people see a loss of strength when they take a proton pump inhibitor. Now, it's really funny because, once again, I'm going to be a little mean this way. This doctor gave such bad moronic advice and said there's really no known side effects of proton pump inhibitors long-term that way. Really? Because this guy does not know how to read, okay? Because he suffers from rectal cranial disease. I'll let you think about that one, okay? Because once again, here we go, on the medical websites, high doses for long-term use. Guys, do you understand long-term use is anything over a year? And some medications is over 3 months. But this one's high-term use. Do you know that we see people taking these for 7, 8, 9, 10 years? Now here's what happens. It increases the risk of osteoporosis and fractures. Why? Well, I always thought it was funny when Tums came out with calcium. Tums with calcium, they added calcium in. Because calcium absorption cannot happen unless there's an acidic medium. Let me say it again. Calcium absorption, to even get it into your bloodstream, cannot happen without acid. That's why one of the major side effects is osteoporosis and fractures. So when you're using this for over a year, you're setting yourself up for a very, very, very weak bone structure that way. And once again, there are people who are taking it for a long time. Here's another thing. Pernicious anemia, where you actually do not get enough B vitamins within your system that way. Once again, B vitamins actually absorb with a very high acidic medium that way. Okay? That's why you gotta be very careful when you reduce stomach acid. And I'll show you some of the natural ways people do it. You have to be very careful because you need good stomach acid that way. All right? Now, it kind of gets better. We could talk about this. Now, here's one thing. Oh, here we go. So here we go. Another one. I love this. Long-term use over the course of a year actually increases the risk of heart attacks. It's documented right here. I love how this doctor pulled up this website, told the patient the massive benefits, and then when the patient actually said this, here's the thing. This one thing about reading, okay? If you do it and actually just don't listen to people, including me, you can actually say, Doc, I think you're full of crap. Good, do some reading, and then come back and tell me if I'm full of crap. Okay, make a comment in the section right now if you think I'm full of crap. I'm pulling up what they produce in there, and what happens is, but here's what the doctor said. These risks are minimal and not to worry about. Do you understand? I love how they downplay all the risks, yet it's very common for these things to happen. This person actually can end up with a heart attack, and I love all the other things that come up from it that way. All right? So think about this. So you say, Doc, but stomach problems are so common today. What? Now here's what people want. Because I'm going to show you, I'm going to actually make some of you guys mad because these are things, for example, that are misused, and therefore, but they have a symptom benefit. So what do? They think it's okay. Let's start here. If you have stomach inflammation that leads to an ulcer, the key thing is this: you have stomach inflammation. Number one, get your food allergies tested. Number two, actually get your stool tested to see if there's any bacteria that have ran rampant within your GI that cause some of these things that way. It all starts with inflammation that way. See, because a lot of people say, Doc, what can we take in replacement from a PPI? Nothing. There is no natural alternative. Now, here we go. Here we go. Let me bring up something that I'm going to do actually. Remember, this was brought up by a patient for me to actually go over the patient. I got the advice from a doctor, but actually one of our doctors bring up this. Doc, what do you think of alkaline water? Okay, here's what happens. If PPIs are actually a very common thing, like I said, 3 of the top 5 selling drugs roughly, okay, anything that calms the stomach down, more basic, is going to feel great to the stomach. It really does. So let me ask you a question. If there's a fire, you put water on it, it goes, ah. Alkaline water, for example, will do what? There's no doubt. If you have stomach, swelling, if you have stomach inflammation, the alkaline water will feel great initially. But alkaline water used long term will massively hurt you. So all these water filtration systems that say, oh, you got to put all alkaline stuff in your body is ludicrous. It makes no biological sense. And I know I just ticked off all you keg and water people that way, but here's what happens. If you're drinking constant basic water, you're going to de-acid your stomach, you're going to put it out, and guess what happens? You're going to cause infections. See, what happens, but here you go. People say, but Doc, my whole stomach changed when I actually started to drink alkaline water. Well, of course, but you're still inflaming the stomach, so all you're doing is calming it down, so it's no different than putting a Tums in there. It's just natural. Let me say it again. You're just throwing a natural Tums in there by throwing alkaline water in there. Over time, you're going to cause major infections in your stomach by doing that. Stomach acid is needed. This whole idea that your body has to be alkaline to be healthy is ludicrous again. See, the thing is this, because people quote that one cancer doctor 50 years ago that said that cancer grows in acidic medium. Actually, I always say, what acidic medium? Because if it's in your stomach, guess what happens? If you have a basic stomach, you can end up with stomach cancer. But here's what happens. Overall, when you look at certain body parts, your stomach is a certain pH, your liver is different, your intestines different, your blood is different, actually your heart pH is different. They're all different. Do you understand? And there's some organs that if you have a alkaline median, you're going to have a very sick organ. See, that's why I generalize for the body when people make statements like that. I'm kind of laughing. Do you understand? Now, there is one test that's very accurate for pH, and that would be actually your urine specific that way. It's actually the only accurate one. The people that measure by the mouth, guess what? Your emotions can change, and your pH in your mouth can change very quickly. But going back to the acidic medium in the stomach, guess what happens? You keep on putting alkaline water, you keep on calming down the stomach for a long period of time, you're going to have some major problems that way. One of the best things you can actually do for the changes that way is apple cider vinegar. Now, let's do this. So let's look at things you can do that actually can calm the stomach down for a short time to help you wean off those things a little bit and then find out what's triggering the stomach inflammation and reduce those things. Now, once again, calcium lactate powder, apple cider vinegar, ginger, chamomile. I mean, my goodness, there's so many things. You could even use alkaline water. You could even use that to calm it down for a short time. But once again, you can't do that long term. And I mean long term, you better not be doing that for more than a month. Otherwise, you're going to really end up with actually not sterilizing your body. And therefore, infections are going to start to go crazy in the small and large intestine. Now, what I want you to think about is this. When you come back and you look at this thing all again, the bad advice that the doctor gave actually the patient was this, is that PPIs are good for you. That PPIs do a great job. PPIs inhibit, they block the enzymes for natural good production because the body knows exactly what it's doing. If I have food coming into my system, my body naturally says, I need stomach acid to protect the rest of my body. And because man comes along and says, wait, because you've damaged your stomach with all this bad food for a long period of time, I'm just going to do what? I'm going to inhibit that. I'm going to inhibit the stomach acid so the food can go in there and just push into the small intestine and large intestine unsterilized is a bad idea. And so a doctor tells you that's safe is moronic. A doctor that tells you you can take this for the rest of your life is moronic. That is not a good thing. That is bad advice. And that's their thinking. And that's their thinking. The doctor sat and said, look how good this is. You know, I've always said this. What separates this whole concept is the way we think. You know, and tell me what you think. If you think that I'm off course on this, let's debate me. I've actually thrown this out there before. Doctors, if you think, for example, any topic, I would love, Brandon, like I said, hormones, anything that way, to debate us on this. Stop giving bad advice and stuff like that, because once again, you are going to hurt this person for a long period of time. This person was only 36 years old, the advice they gave this person. 10 years from now, after taking this for a long period of time, osteoporosis, heart risks, all these other things that go on with that. That's not good, guys. We have to stop this. And once again, Durham, and I listen to this all the time from actually people I know that are in the medical field, that, well, it's okay. No, it's not okay. Why don't you tell the person to stop eating bad things? See, a lot of people don't want to hear that. Most Americans don't want to hear that. Most Americans love the commercials of Larry the Cable Guy sitting on there saying, I can eat whatever I want and just take the pill. Okay? It doesn't work that way, guys. It doesn't work that way at all, because there's long-term negative effects that happen to all this stuff that way. We got to be very careful. So my idea of getting upset about this is nothing more than that patient's long-term health. I don't get any benefit from somebody, not taking a PPI. You know, the one thing that I do want to see them, though, is actually get their foods tested, get the things that are actually now disrupting that stomach. Once again, because you can actually have a perfect organic food, and if you're allergic to it, it's going to cause inflammation to the stomach. That eaten over a course of time will do what? Will cause stomach swelling, will actually cause inflammation there, and now when acid's doing its normal job of sterilizing everything, it's going to burn. Do you see what I'm saying? Don't keep on eating that food. Don't just reduce the symptoms by blocking the normal function of the body, the way the wall works. Actually find out what happens. Because let me ask you a question. If you look at all the negative side effects that come from it, guess what happens? You know, and here's one thing that's funny. When a person ends up with dementia or gynecomastia or all these other problems that come with it, your doctor will never come back and say, yes, I caused that. They'll say there's so many factors that cause these things. Actually, the number one factor is the bad advice you're getting. You're getting horrible advice. I always tell people, unless you're dying, going to a medical doctor, guess what happens? You basically are going to make you extremely sick, because this is what they're doing. And you say, Doc, you're picking on Purveya. I'm picking on all of them. Do you know what I'm saying? Because one thing that makes me frustrated, why some people say I'm mean sometimes, is because I watch people just like this 36-year-old that actually literally, when she ate almost everything right now, she bends over in massive pain. So here's what I asked her. I said, young lady, how long have you been seeing a doctor? And she kind of looked at me funny. And she said, all my life. I said, wow, you better go back and ask for your money back, because they did a very crappy job taking care of you. See, it's kind of funny. Healthcare, we have constant problems. And instead of stepping up and telling, no, do you think my advice for this young lady was well accepted? I looked at her and said, listen, you may not be able to eat so many things. Is it easier just to take a natural supplement, calcium lactate powder, maybe some ginger, maybe some chamomile liquid and stuff like that to calm it down? Sure it is. But it's going to take a lot of behavioral change to do it that way. And most people don't want to change their behavior. They just want the purple pill. They want the Prilosec. They want the Nexium. They want the Prevacet. They want the alternatives. You can actually do this. You can type in alternatives, the PPIs, and get a list of everything I just told you and more. But that doesn't change the thinking. The alternative thinking is just as stupid. Medical thinking, alternative thinking is the same concept. Calm the fire down either medically or naturally. Yes, natural things, you have less side effects, but the thinking is still just as problematic. Because if you drink alkaline water long term, you're going to be sick. If you're taking calcium lactate powder long term, you're going to be sick. If you're taking all these things just to calm the stomach down, you're going to get massively sick, because the thinking leads to the constant reaction to all these problems going on. So, Brandon's going, Patrick, you said you're going to be under 15 minutes today.
Yeah, it's almost there.
He's laughing. I thank you guys for always watching. Today was a little bit more intense and stuff like that, because once again, I will tell you this from my heart. I get very frustrated watching people suffer. big time. This young lady was suffering and got bad advice for a long period of time that way. And once again, it doesn't mean my advice for her was easy, but my advice for her was right. Because here's what happens is this. She was definitely on a wrong path and it was leading down destruction. And the sad part is this. It was affecting her personal life, her work life. It was affecting everything. And at least the Wellness Way doctors are strong enough to say, listen, the advice you're getting is bad. And we'll at least be strong enough to tell them that. So, Dr. Patrick Flynn here, covering PPIs. Look this up. Look up on all the medical websites I just told you about that way. It's kind of interesting. Stomach acid is an extremely good thing. It's needed for your body to sterilize everything. PPIs interfere with that normal production. There's so many ways to get that stomach and intestinal tract back to normal. You just need to find the right doctors to do it. Currently, as we know today, stomach problems, PPIs, all intestinal problems are an all-time high. You need to start thinking differently. God bless you guys. Have a beautiful afternoon.